You know, surviving cancer is always a reason to celebrate, but there's also the uncertainty that comes with the celebration, wondering if it might return, questions about how the whole experience changes your life. We're talking about what to expect with Lindsey Causey. She is an adult nurse practitioner and a survivorship nurse practitioner with Cone Health Cancer Center. Good morning.
Good morning.
It is a great ball of mixed emotions that people who survive cancer come out with. You know, you're feeling good, but there's so many questions, and it's tough. You feel like you ought to celebrate, but there's a lot of other things going on, right?
Yes, so when patients are diagnosed with cancer, their life as they know it has come to a complete stop.
It's the thing you never want to hear.
Exactly, and that can be really overwhelming for patients to think about the possibility of what may happen and a brush with the thought of their possible mortality. And so as patients go through their treatments or their acute phase of survivorship and they go through their surgeries and radiation and chemo, then once they finish with that and they go into the routine follow-up, they kind of don't know what to do. And their role changes with their work and their circle of friends, with their family, the financial impact of their care, long-term side effects they may possibly have had from their treatments. That all kind of plays into effect, and that's when transitioning to their new normal happens, but it can be challenging for some patients.
I guess that's where you come in, because that person could feel kind of abandoned. You know, I was going to the doctor, it seemed like every day, and all of a sudden I'm not anymore, and their care isn't over at that point, right?
No, their care is not over, and they just sit there and they're like, well, what now? What do I do? Because it's all stopped. And so that's when I come in, and at Cone Health we have a survivorship care plan, and I sit down and I meet with the patients and we talk about their treatment, their staging, we reflect. We look at possible side effects from their treatment, both acute or initial and possible long-term effects. And we look at moving forward, where do we need to go? What kind of follow-up do we need to have? What kind of screening? What kind of testing? How often do you need to see your primary care provider? How many times do you need to come back here? And who do you see when? And that's what we do.
Is it for the family as well? Because they're kind of a support network around them too.
So yes, and the family comes to those appointments, and we also give them different support groups and programs that that we have and we offer at the cancer centers across the triad.
Well, listen, thank you so much for telling us about it. It is so important. At one of the worst times of your life can turn into a much better time when all of a sudden you're out the other side. Thanks for helping them navigate that sort of thing. Yes,
and the support groups and the chaplains and the social workers, the whole team really does a lot.
Well, thanks for telling us about it. And she just mentioned support groups. Cone Health, by the way, offers an 8-week program called Finding Your New Normal. The next one starts on Monday, February 4th, 6 to 8 p.m. at the Cone Health Cancer Center at Wesley Long in Greensboro. The number's on your screen if you want to register, 336-832-0688. There's also a cancer support group that meets the second Tuesday of each month from 1 to 2 p.m. at the Cone Health Cancer Center at Annie Penn in Reidsville. You can register for that by calling 336-951-4674. And for more classes and programs, you can always check out conehealth.com/classes.
House Call on Fox 8 is sponsored by Cone Health.